Good afternoon, Dr. Ida Khanum from Pediatric Pod Concierge Pediatrics in Bel Air, Houston, Texas. So over the weekend, I got a message. Actually, not over the weekend. It was on Friday, late Friday. After clinic closed, I got a message from a mom saying, my little fellow, he's about 2.5 and hasn't had a bowel movement in 3-4 days. Seems like he's uncomfortable, not wanting to eat too much. And then when he did finally have a small bowel movement, it was really hard. And so, the concern was for constipation and, what would I recommend? And again, my baseline is I always try to recommend food. So, there are certain foods that are really good to prevent constipation as well as to treat constipation. So, number one, we want to make sure your child is hydrated. We want to make sure your child is having high fiber in their diet. But at the same time, there are 4 fruits that I recommend. It's prunes, papaya, pears, and apples, okay? Prunes and papaya are the most effective, in the sense if you have prunes or papaya and your child likes that, those are the best way to keep your child's bowel movements regular and soft. But pears and apples as well, those 4 work really well. And so the goal should be, if you have a child that may be more prone to getting constipated or doesn't drink enough water, doesn't have enough fiber, but they like any one of those 4 fruits, I would say add them to their diet on a daily basis, 1 or 2 servings every day. If you're going to give a fruit, that's the fruit you want to give, because that's more likely to create more regular bowel movements that are soft and prevent constipation. And so that's exactly what we did. We went ahead and I recommended doing prunes, the fruit, as well as a little bit of prune juice that was more natural, and did it quite frequently. And within 24 hours, he started having softer bowel movements. But again, my focus is prevention. So just some information on constipation.